I'm Mindy Peterson, and this is Enhance Life with Music, where we explore the ways music makes our lives better and spotlight the resources you can use to enhance your life with music. Today, we're talking about exciting tools that are available from a company in the music health technology space. I learned about this company recently through the Sounds Good Substack by Rob Marshall. Shout out to Rob. When I saw his description of Coro Health's latest research and offerings, I was intrigued and immediately contacted them for an interview. Joining me today from Austin, Texas, is the co-founder and CEO of Coro Health, David Schofman. David is active in this intersection of music, neuroscience, and healthcare. I'm thrilled to have him here today to tell us about Coro Health and the tools that it offers. Welcome to Enhance Life with Music, David.
Thanks, Mindy. Appreciate you having me very much.
Well, looking forward to our conversation. Starting out, just give us your elevator pitch for Coro Health. What is it? How do you describe it to people who aren't familiar with it?
Yeah, so I guess I'll give you a little background on the company first, if that would be useful. So I started the company a long time ago. We just had our 15-year anniversary in 2008, and really, it was a catalyst of a couple of things that came together. My mom's a hospice nurse and was for 30 or 40 years, and was always talking about how she leveraged the power of music as part of her care plan, and dating myself and her. But, she was a traveling hospice nurse. And so she would go to homes and she would carry stacks of CDs, and back then Sony Discman players, for those in the audience that are old enough to remember that.
Oh, yeah.
And she would ask them questions. She would leave them music. She would play music. She would sing with them. And then when they would pass, she would pick up her music and go to the next patient. And I'd heard those stories obviously for years and years. And then in around 2006 or 7, our middle daughter started developing some challenges, and we realized she had a rare chromosomal disorder and was struggling with speech. And I stumbled truly across this whole field called music therapy and really didn't even know what it was. And we're lucky enough and blessed enough to be in Austin, Texas, which is, besides Nashville, probably the largest. We call ourselves the music capital of the world, but that might be a little bit of a stretch. But and here in Austin, there was a number of music therapists and designers that were kind of world renowned. And so, as parents, when you're looking for ways to help your child, we were looking at everything. So we decided, what the heck, we'll put her in one of these music therapy programs and see what happened. And again, very long story short on that is that we started seeing some pretty remarkable progress with her engaging and physically and mentally and from a speaking standpoint with the music. And we were like, holy cow. And this is really interesting. And so, I'm a serial entrepreneur and have done 6 different companies now, and also an amateur musician. And so it kind of just, the business part of my brain and also kind of the heartstrings, said one day, this is an amazing field that's so interesting. I started doing homework and research on the power of music in the brain and talking with neuroscientists and different music therapists, and realized this is great, but it's, being totally frank, it's not a great business model. And I mean that by, there's just not enough music therapists in the world to be able to service the need. Mm-hmm. And although they have all this amazing research and all the great work they do, it's expensive and it's just not available. And so we kind of sat down with a team of, like I said, of music therapists and music designers and technologists and said, there's got to be a better way. And can we take the knowledge and the research that's been done and build prescriptive music programs? And so that's really the kind of the long answer to your initial question, is that Music First, which is our product, was really designed to be, the tool that caregivers use first, before pharmacological or other types of intervention, to try and ease, whether it's pain or agitation or depression or stimulate appetite or all the different things that our programs, work on, to utilize that as a tool for them when a music therapist is not available. I mean, we always believe that first and foremost, that's the best way to go. We're never going to replace them. Obviously, live music, one-on-one with an individual when you're seeing their emotional and physiological responses is always the best, but it's simply not available. And so when they're not available, we wanted a tool that was simple for them to use. And so that's kind of how it was all born in the beginning.
Well, you sort of answered one of my questions too, which was going to be why Coro Health? Why do you see a need for this company and the products? And you really answered that. And I do hear what you said all the time, that there just aren't enough music therapists for the need. And it's great that we're seeing a demand and a need for it. And it's becoming a little bit more mainstream. And I think one factor and component in that is there's so much great research that is coming out. I mean, that field really is exploding in terms of demonstrating scientifically the efficacy of music therapy, and the functional MRIs are really feeding into a large growth of that. So that's great. Hopefully we'll see more and more music therapists coming into the field, but that's great that your product is sort of filling a little bit of a void, whether people don't have access to music therapists, or, as you mentioned, it's expensive. Insurance doesn't always cover it. In fact, often doesn't cover it, but I feel like that's changing also. So tell us a little bit about music first. And then I also want to talk about who it's for, because I know you do a lot of work with elderly populations, but I think you also make this available for other demographics as well. But tell us a little bit about Music First, that product.
Right. Yeah. So it's, everything we do is using music to drive a very specific outcome. And so if you think about it kind of at a high level, the hierarchy of what we do, we look at wake, sleep, energy, and relax as kind of our core 4 tenets. And then based on the answers to a series of questions that we ask each patient or resident, we take that information along with their genre and their style preferences, and we use machine learning and AI and 15 years of doing this to dynamically generate a playlist for them that is specifically catered to drive that outcome. And kind of what makes us really unique from an intellectual property and a patent standpoint is that we've developed a process where we look at approximately 20 to 30 different characteristics of each song. We call it the musical DNA. We break down the song into, different characteristics, like obviously you look at tempo and instrumentation, vocalization, brightness, key, speechiness, valence, and we numerically categorize all of those songs. And then we put them in a very specific order in order to drive a very specific outcome. So I know our listeners are not seeing what I'm doing with my hands, so I'll try to describe it with not being visual. But if you think about an energy program, and you think about a graph, if that energy program will start with a song that's kind of in the lower left-hand corner of the graph and slowly increase up and to the right as each song progresses. We call that a musical feature slope. So the feature slope increases if you're trying to take somebody from a certain position of low energy to a certain position of high energy, it's going to go up and to the right. Conversely, if you're trying to relax somebody and they're in an agitated state, you would start in the upper left-hand corner of the graph and you would move it down and to the right. So it seems pretty logical, but there's a lot of obviously science that goes behind that to take all of the different songs and all of the different genres and styles and break them down in order to order them properly in sequence to drive a specific outcome. And so we use that algorithm, for wake, sleep, energy, relax. We also do it for mood stimulation, appetite, pain management, increasing movement, all of the different outcomes that we look at when we're doing a prescriptive music program for an individual. And so that's kind of we call it the science behind the soundtrack of how we build it. And so that tool is used by caregivers and patients / residents themselves. So in the case of, to your question about kind of the environments that we serve,
Uh-huh.
so we've got a broad range. So, you mentioned hospital, acute care market. We've got about 200 hospitals. In a hospital environment, generally, not always. I mentioned a story about my father-in-law who recently had a heart attack and is in the hospital, so wasn't able to kind of manage a TV or a device on their own. So even in an acute care setting, they can use the program by themselves, for wake, sleep, energy, relax, obviously, or a caregiver can go through. In the case of my mother-in-law, she would answer the questions on behalf of my father-in-law because she knew what was going on with him. She knew his style and genre preferences. And then we would play both relax and energy programs depending on what he was doing. So when we were preparing him for physical therapy, 3 times a day as he's recovering from his heart attack, 30 minutes before, we'd play an energy program for him, and he likes show tunes. So that's what we were playing, a show tunes energy program for him. And to try to get his heart rate up, his respiratory rate up, so that when they came to get him for physical therapy, he was in a good place for that and ready for that. And we had energized him. And the opposite would be true, obviously, at night. He suffers from some brain damage from the heart attack and has a little bit of sundowning syndrome. And so 3, 4 in the afternoon every day, he would get really agitated. And, totally being frank, they would want to, give him Ativan and give him Haldol and to try to calm him down. And my mother-in-law was, completely against that. But sometimes, he developed such an acute challenge that they had to. And so same thing, we would play the relax programs for him starting at about 2 or 3 o'clock to try to limit or reduce or alleviate completely the need for an Ativan or a Haldol or some sort of cocktail that they were going to bring him, in that kind of situation. And so, real life, I'm going through this in real time over the last few weeks. As you know, we spoke before we got on the phone.
Right.
Here. And that's a real life. So that's in a hospital setting. Then we also serve, as you mentioned, in kind of our core and where we started foundationally was in long-term care. And so we're in about 6,000 long-term care communities all around the country, focused in North America only. And so inside of long-term care, you've got hospice, you've got independent, you've got assisted, you've got memory, skilled, and kind of respite care, right? And so in those environments, very similar to what I was talking about in the acute care market, those are either resident/patient led, and or we have relationships with a lot of engagement content providers that actually have devices kind of next to the bedside that are delivering, they're delivering TV, they're delivering menus, they're delivering entertainment. And we've kind of become the default therapeutic music and faith programming for them. And so they will schedule that content to come on automatically at certain times of days for certain residents based on certain conditions. So memory care is kind of where we started in long-term care. I mentioned earlier with my father-in-law sundowning, this is a real issue for caregivers. I mean, patients get real agitated and confused. And so, we have very specific programs for sundowning that we play or recommend that are played every day around 3 or 4 o'clock. And it does a couple of things. One is it helps just in general set the tone. And if you've spent any time in a memory care locked unit, those can be kind of all over the board as far as what you're getting, as far as, what residents are acting like and what their mental acuity is. And again, these afternoons are kind of witching hour. And so playing our sundowning programs, helps with that. It also becomes very Pavlovian for the residents because they know when they hear certain programs at certain times of the day, it triggers certain events. And so,
Sure.
it's kind of funny actually, because kind of a side note here over the years, we don't get complaints very often about any of the content that we play. We obviously work very hard at that. The number one complaint we get from caregivers is, oh my gosh, if I have to listen to this same playlist one more day, I'm like, due respect, Mr. or Mrs. Caregiver, it's not about you, and your residents don't remember that they heard that yesterday, or if they do subconsciously, they know it's dinner time, right? Or they know it's an activity time. And so again, it becomes very Pavlovian. So in memory care, we're repeating a lot of different programs that we've done clinical trials on, and we know that work, to reduce agitation, that help increase, another really confusing part of memory care is dinner time, breakfast time, lunchtime, feeding, right? And the life of a caregiver is basically, go to Mindy's room, get her up and ready for a meal, which that is a process in herself, transfer that individual to the dining room, and then, wait for the food to be arrived and then go and get David, right? Well, in the time that they go and get David, Mindy often says, I'm out of here, and gets up. And so it's this carousel, right? So, but if we have music that's playing, and we've seen this, a lot of our customers have done studies around this. We've never done a formal clinical trial on this specific point. We've done it on others, but that the music will help them stay there and stay engaged and eat. And
Yeah, provide
we
some structure for
provide some
them.
structure. Exactly. Well
Yeah.
said. Well said. So anyway, lots of different environments that we use the product, and use cases for different benefits for it. So long answer to your question, but hopefully.
Yeah. Yeah. Well, this algorithm tool that you use, I think it's a patented product called Music Prescription Builder, right?
Yes, correct.
Which is it's really cool. I mean, you have a whole team of music therapists that you work with, music designers, neuroscientists who
We
all
do.
have worked to create this tool. You've also done a lot of research on this product and this whole process. Tell us a little bit about the research. I mean, these are evidence-based products. Tell us a little bit about the research, the clinical trials that you've done and that are ongoing.
Yeah, so we've worked a lot with Dr. Peter Janata at the UC Davis Mind and Brain Center, and Dr. Janata is kind of our lead researcher, and initially did our first clinical trial work, going back to 2010 or 2012, and we were focused specifically on individuals with cognitive impairment and reducing agitation and depression in those individuals across multiple sites and multiple individuals, and it's interesting. I'll kind of take a step back and then I'll finish that story, I promise. But what we realized when we took the product to market, Mindy, was that people were like, yeah, we understand the power of music, but we've got a radio. Or, we understand music, but we've got CDs going back to when we were, or freaking 8 tracks, basically when we started. But, we've got music. We've got it on the TV. We got it, whatever. And what we realized is that, when we launched and we started testing in long-term care, we got all this unbelievable anecdotal feedback. People are like, this is incredible. And, we're not administering as many drugs, and people are eating more, and agitation's down in the evenings, all these things. But they were like, that's all great, but without clinical evidence, we're just not going to pay for it. I mean, that's basically what it came down to. And so we were like, okay, well, we know this works, so we have to go out and prove it. And so doing clinical trials is extremely time consuming and expensive, but it was an investment that we had to make, and we continue to make. And it's part of our journey. We have to continue to get better and do this. So our initial clinicals that we kicked off, we knew what the results were going to be, but we had to see it, and we had to document it. And so, we showed remarkable results, like 54% reductions in agitation and depression, and, had that published in the Journal of Music and Medicine, and it was obviously peer reviewed, published. And since that time, so that really put us on the map. People were like, holy cow, this really works. I can justify to my boss,
Sure.
spending money for this. Really, at the end of the day, is what it is too. And
well, that's probably helpful for insurance coverage and reimbursement too.
It is, and it's you mentioned early on in your opening, about insurance, and we should come back to that, but that's a whole different thing. It requires an enormous amount of research, and it is thankfully catching up with what consumer demand is and what the research already shows is there. But getting the insurance folks to reimburse and write a check is never easy, right? And especially something that feels anecdotal and people just don't get it, or they think it's a free product, and so it works. But anyway, back to the research. So we've done our kind of phase 1 clinical trials. We've done an enormous amount of clinical studies with customers over the years, showing these increases in appetite that I talked about, showing, decreasing in wandering and activities, and increased participation in activities. And so we embarked about a year and a half ago on kind of the next phase, which is our, a fast track phase 2 clinical trial with support of the NIH. And so we've been working through that process right now. And what we're really going to be focused on here is the next generation of our music prescription builder, and seeing that it works better than the first one did, because we have more data, we have more machine learning, we have AI tools now that we just didn't have in 2010, 2012. And so, we know it works better, but we have to prove that it works better. So we've got to prove that foundation. We're also going to focus, so individually, and with individuals with cognitive impairment, we'll be focusing once again on agitation and depression, and trying to increase those scores even better than we did a decade ago. We're also
Which was great even then, right? A decrease in up to 54% of agitation and depression.
I mean, it was insane, and we think we can do. We think we can do even better, to be honest with you. So, we just think the programs are better now, and so there's that piece, and then we're also focusing a lot more on dining, because we have so much anecdotal evidence on the dining programs. And again, think about that energy and relax again, what we're doing in dining. So very specific music to a very specific tempo that we're trying to help people with staying put and also continuing to eat, and also helping with digestion. And once again, a breakfast program would be similar feature slope to an energy program, and a dining program would be similar to a relax program, where we're not only trying to keep them engaged in eating, but also trying to get them mentally prepared either for the day or for the end of the day. So we have very specific programs and so we hear, and to be honest with you, our dining programs are our most popular programs played as far as pure MP3s downloaded, and streamed per month. There's more dining that our customers use than anything else. So we're like, okay, the customer's telling us this really works. We need to go out and prove that we've got the best dining programs on the market, because there's a whole nother market that we haven't even gone after, right? Which is, like food, hospitality, and lots of other areas. So kind of first phase of the phase 2 is agitation, depression with people with cognitive impairment. The second kind of, a parallel path with that is dining. And then the third, which is really important to the NIH, is reducing caregiver burden. And so that's a big one, right? It's got to check that box, is be able to show these caregivers, as we know, are understaffed and underpaid. And if they can use music as a tool, they can use our tool to, make their life easier, and conversely then translate to making the patient's life easier and better, then that's a huge win. So those are the three kind of pillars that we're going after in this next phase. And it's a $2.5 million 2-year study. It's going to be, by our research, I don't know that this is 100% fact, but by our research, it'll be the most comprehensive study ever done in this field on those specific areas, right? Nobody that we know has ever done this kind of research before.
Wow. Well, and speaking of caregivers, that's another area where we have a shortage of them. And so if we can reduce burnout,
right.
I mean, that's a win-win for everybody. And as you're talking about this dining and sundowning, I'm just thinking of my experience as a young parent. I don't know if there's an equivalent sundowning with infants, but I feel like there is. I feel like we experience it, because I remember late afternoon, like without fail, our firstborn would just get fussy and, cry for no reason. And I remember the Baby Einstein videos.
Yes, of course.
And since then, I know there's been additional research that sort of discounted the original claims that was behind Baby Einstein products. But I'm here to tell you, I don't care about that, because I'm here to tell you those worked like magic for my daughter. And as soon as she would start doing, it was around the time we were just trying to get dinner ready, I would put her in front of that. And it was just like magic. I mean, she would just stop crying. She was just mesmerized. And so we could make dinner, and then it made the dinner experience so much better, because she was happy and content. I was happy and content. We're going into it not in this frazzled state of irritation and angst, but going into it feeling good and feeling content,
Right. And a lot of those programs, talking about, I mean, the parallels between as we age and when we're born, as we all know, are very similar, right? The way
Yeah,
that, and so, it's very much childlike behavior when you get older.
sure.
And so, that same kind of Pavlovian, reference that I made earlier on sundowning was absolutely true. I have three girls. When we were, doing the same thing growing up, I mean, it was in raising them, those programs, and the consistency of those programs around the time of day and what was going on. I mean, it makes a ton of sense, right? I mean, it's the same thing.
Sure. Well, and I can see the positive impact on your programs for the patients, the residents, also for the caregivers. And then I just think about other people who are in that environment. My grandparents all died quite young, but I have very vivid memories of visiting some of them in nursing homes. One of
Right.
them, my grandfather did have Alzheimer's, and it was not a pleasant experience.
No, they're not.
It was creepy. It was scary going in there, and you had other residents who were screaming and banging on high chair trays with wooden spoons and wearing bibs. And as a little kid, it really freaked me out. And I can imagine if you have appropriately selected music that's playing, it's not only calming the residents and their caregivers, which influences the experience for visitors, but just the music itself would influence the visitor. When you think of kids coming in to visit relatives,
Right.
that would make a whole world of difference. And it would make the experience more positive, and it would sort of create a bit of a sonic memory that those kids would have associated with the grandparents. So after their passing, when you hear those songs, it would remind you of visits with grandma and grandpa, and hopefully
Right.
be a much more positive memory than what mine were. So I think there's just a lot of layers of positivity and benefit with your product. One of my favorite places to turn for instant gratification and a dopamine hit is browsing digital sheet music at sheetmusicdirect.com. This online store is powered by music publisher Hal Leonard, and it has over 1 million arrangements that you can view, listen to, and download. No need to buy an entire book for that one song you love. Create your own library from selections representing all levels, instruments, genres, and holidays. Prices start at 99 cents, and you can both print your purchases and access them on any device, which is really handy for those of us who travel or are trying to go paperless. I would say this is my guilty pleasure, but it's actually a guilt-free pleasure. There are so many brain benefits to reading music, making music, and experiencing new music. Instead of subscribing to another streaming platform, subscribe to Sheet Music Direct to treat yourself and your kids to real brain food and a guilt-free pleasure. Access the latest hits and yesterday's classics at sheetmusicdirect.com.
This is Bob Bender, host of the Business Side of Music podcast. Check out our show where we talk about all things related to the music industry. We laugh, we share memories, we discuss what's worked and what didn't work. Our industry is always evolving and can never be locked inside a box. From the rookie fresh off the bus to the well-seasoned professional wondering which new direction to take their career, our show covers all the bases. Join us as we chase this elusive animal we like to call the music industry. Check us out at businesssideofmusic.com.
Tell us, I know you have a few other products. There's Sing Along, Care Radio, and Faith First. Tell us a little bit about those, and then I want to hear about the availability of all these products.
Right. No, thank you. And just adding to your comment really quick about the environments. I mean, it's my mom told me when I got into this space, she said, you're going to see a side of the world. She's talking about especially Medicare, Medicaid, state and federally funded, skilled nursing communities. Private pay is a little different, but she said you're going to see a side of the world that's going to probably change the way you think about your elders and what life in the U.S. especially, and how we treat our elders and the environments that they go into. I mean, these are some of them. I mean, we're in 6,000. There's some of the, I want to go live in right now, right? They're so nice,
Yeah.
but there
Yeah.
are others that, that are rough, and it's a tough environment. And when you go in there and, like you said, you hear screaming, you hear yelling, the smell is usually overwhelming too.
Yeah.
To be able to bring some joy and some consistency in those environments, is why we do what we do. I mean, it changes everything. And it's so frustrating to us at the same time, because it's something so simple, and something
Yep.
so inexpensive. So
Yeah.
it's just, it's silly. So, transitioning to your last question is, one of the things that we learned over the years of running the business is that, we had a great product that was focused on therapeutic outcomes in our Wake, Sleep, Energy, Relax, and our Music First program. But, we had a lot of customers that said, however, that's great, but we still have more entertainment needs for music as well. And so, your product doesn't do everything for us. It's just a piece, and we want one-stop shop, basically. And so, I fought that for years, because I'm like, we're not a musical entertainment company. That's not what we do. And then I realized, music isn't. I use Pandora, I use Spotify, so I was a hypocrite. I use that myself. I don't just use our own product. I do have a need for just going out and playing top 40 and listening to what's going on. And, I listen to it whether I want to or not, with 3 teenage daughters. But, we all have, and so we launched 2 other products, Care Radio and Sing Along, to really try and round out the offering for everybody. And so Care Radio is a genre-based entertainment platform, very much like an XM radio or whatever, playing hits from the 1920s through to today. We do use some of our algorithmic formulas on playing certain types of programs certain times a day, but it's not as prescriptive as what you would find on the Music First side. So it really just covers the gaps in between, also allows them to have music they're playing in common areas, and which makes sense. And so that's really what Care Radio is. And then Sing Along was really born from, again, requests from customers on, we're doing groups, and these are activity professionals generally that are working in group settings of, we bring in disc jockeys and we bring in karaoke singers, once a week or twice a month or whatever. But, can you provide us with that kind of program so we can do it more often? Again, it'd be great to always have somebody in person, but it's expensive and not easy to coordinate and not available everywhere.
Sure.
And so that's why we did the Sing Along Pro. So we've got thousands and thousands of Sing Along programs, specifically catered, mostly towards long-term care, more so than you would see in an acute care. You're not going to probably see someone who just had their kidneys taken out, belting karaoke in the hospital bed, but it's really designed more for groups and long-term care, independent, assisted, skilled, all of those areas where they bring individuals together 3 or 4 times, and they're just looking for activities to do. And so that's where Sing Along came from. And the last point I'll make on that for transitioning to the faith is that another big part of what we do, which we kind of fell into, to be honest with you, was covering all of the music licensing for all of our partners. And so music licensing is extremely expensive and required, regulated, obviously, and also not as well executed upon, maybe is the nicest way to say it. In other words, not everybody's in compliance. And we find that all the time. And most of the long-term care communities we go into are not paying the proper licensing that they should be. And so they're subject to fines, and ASCAP, BMI, CSAC, the PROs have gotten more aggressive in the last 4 or 5 years. They used to just kind of look the other way. It's bad press to, give a fine to grandma or grandpa, but the dollars are in the billions now. And so they're starting to scratch that industry a little bit and say, look, you got to start paying up. Well, it's anywhere from $2,000 to $8,000 a year to cover all the pros for a long-term care community, depending on the number of beds that you have and number of events that you have and everything else. So it's really expensive. So our customers were asking us to cover all their licensing for them. So if they standardize on it, so to do that, we had to have a full array. We had to have therapeutic music. We had to have Care Radio. We had to have Sing Along. And so now we have a complete solution. We can cover all their music licensing. So that's another reason why we did it. So moving on to the Faith First product. So this has been probably one of the hardest things I've ever done in my life, to be honest with you. So we started Faith First, over a decade ago, because back when we launched the company, again, I'm dating myself, there was no streaming. And so, we had hardware in a room. We had a computer in every room with speakers. We had Cat5 cable running from a nurse's station into every room. We had our caregivers taking music intake forms and faxing them to us. And we were building programs, sending them thumb drives, and they were loading them and playing. I mean, again, I'm really dating myself. So, but we had all this hardware infrastructure. And at the time we had 500 or 600 locations, and they were like, we ask our customers, what else can we provide you? We've got this box in the room that provides audio content. Uh-huh. And we did a survey, and anyway, resounding came back to us as, we need spiritual support. I mean, we have no spiritual support. We have, maybe we have, a couple of volunteers, that come in. If we're lucky, we have some pastoral care, but they're basically just walking around doing last rites. They're not able to engage in individuals and really provide them full spiritual support. So, being kind of ignorant and arrogant, as I can have a tendency to be, I was like, oh, this will be easy. We'll just, call up Joel Osteen and throw some stuff up there. Everybody will be happy, right? So this will be real easy. So not exactly. So the opportunity, I'll start with that before I get into the challenge. The opportunity with Faith First, and again, same name, same philosophical meaning behind it. Use the faith first, when you can, versus another type of intervention is especially those individuals that are in long-term care, and being totally blunt, are in the last chapter of their lives often, looking for meaningful spiritual support is very important.
Sure.
And just like music therapists, like I said, spiritual support individuals are few and far between. And then those that are even there are, generally, and I mean this out of all due respect, but they're generally very biased in one spiritual or religious belief. They're Christians, they're Jews, they're Islamic, they're Native American, and so it's not fair for them to go into a community and try to support, 7, 8, 9 different denominations of faith. It's just impossible. It's an impossible.
Sure.
You're asking the candy striper, to come in and support someone who's a Buddhist. It's just not going to happen most of the time, right? And so they needed a tool too. And so that's why we created Faith First. And like I said, it's probably the hardest thing I've ever done, and continues to be, because it is a, living, breathing, it's about, 1,000 hours of video content across Christianity, Catholicism, Judaism, Buddhism, Muslim, Native American, and general spirituality. And within that, we cover, illness and dying, grief, loss and isolation, transition and aging, life meaning and purpose, Bible studies, worship services, weekly mass. I mean, it goes on and on and on. And kind of the last thing I'll say on that is how do we curate that? And we have a team of, we call it a wisdom council, which is nurses, doctors, activity directors, clergy, spiritual care providers, and board certified chaplains that all curate and approve all of our programming. So it's a beast. And by the way, music is a really big part of that, as you would imagine. So all the hymns and all and the chanting and the hymns and the spiritual content that goes along with that for each spiritual and religious belief is so music's I probably should have led with that, but that weaves into all of our spiritual programming.
Wow. Well, tell us about what facilities and individuals can access your product. Is this just for facilities? Can individuals purchase these different products?
Yeah, so we focus, specifically on hospitals and long-term care communities that we sell to. We don't sell to any individuals today, and it's something that we stuck our toe in years ago, and candidly struggled with, just because the resources required to compete with the big music streaming services are a bit overwhelming. And mostly the reason why we don't do it, again, being totally transparent, is that the licensing costs are completely different for individuals versus it is for selling to a business. Okay. And it's just for a company our size, it's cost prohibitive for us to do it. I would love to do it. It's on the roadmap someday. But it's just cost prohibitive for us to do it today. So what we'd like to do is license our technology to somebody that did have it. And that's kind of the way I'm pursuing that.
Sure. One thing that I love about what you're doing is you have identified some situations where collaboration is possible and you don't need to reinvent the wheel. You've partnered with 7 different companies, I think, on additional content for engagement, and all of it's gone onto a single platform called Quilt. Can you tell us just a little bit about your partnership with Quilt?
Yeah. So the company itself is called the Engagement Bundle, and Quilt is the app that we use to deliver that content. But the Engagement Bundle was born out of a bunch of my peers that are selling content into the long-term care industry. And we all kind of were bumping up against each other all the time. Maybe you call it frenemies or whatever. We're fighting for the same budgets. Selling to the same people as far as, usually activity professionals, executive directors, wellness people, and covering kind of the 7 different dimensions of wellness. And, we have faith and obviously with us and music with us. And then we have fitness partners, we have travel partners, we have Remnants Therapy, we have Curiosity U, which does, lectures from major universities and professors all over the world. And so anyway, we're always bumping up against each other. All of our products were basically priced at the same thing. We're all selling. And we were like, myself and the founders at Spiro 100 who do the fitness, got together one day and we said, this is ridiculous. Like we're all, we kind of had a support group where we would have a call every 2 weeks and we would get together and we would talk about, who we're selling to. And we were sharing all this information. And anyway, it was just like, we need to work together. So long story short on that is the Engagement Bundle pulled together, today, what is 7 and soon will be 12 or 15 of the best content providers in the long-term care industry. Then we partnered with Quilt as a technology partner to bring it all together with a single sign-on. So we have packages that communities can buy so they can get all of the content, single sign-on, device agnostic interface, whether it's a web or an app or whatever. And they get access to all the best content partners in the industry. So we're super excited about it. We have a lot of big news coming in the months to come on big partnerships that we're doing because it's a one-stop shop for long-term care. And they just makes a ton of sense because they're like, I don't have to mess with 7 different vendors and 7 different logins and 7 different.
Yeah. I was just going to say 7 different passwords. Oh my.
And turnover in that industry is so high that it's just nightmare. Yeah.
Sure. That sounds fabulous. And I just think of so many current trends that are so relevant to what you're doing in terms of, we already mentioned the research that's exploding that really validates the efficacy of these types of therapies, right. But also you have an aging population. You have trends toward holistic wellness where people are really interested in right. that and interested in interventions that are non-pharmacological if they're going to work, right. or even just mitigate the reliance on meds or decrease the reliance on meds, right. Reduce the dosage. You have alternative forms of care that are just becoming more widely accepted and requested. You have movement in the insurance industry toward reimbursement, which I'd love to hear more about, but I know we're already over. And just kind of that movement toward personalized medicine too, right. where your prescription builder makes it easy for you to get your personalized music, depending on what your needs are, what the desired outcomes are, what your musical preferences are, and all that kind of thing. So pretty exciting what you're doing.
Yeah, thank you. Yeah, no, we're 15 years young and it still feels like we're on first base sometimes. So we've got a long way to go still, but there's a lot of passion behind this. And I've had the same team for this entire 15 years. It's so passionate about it. And we work really hard and it's a grind, but it's, we get so much out of it. We hear these stories every day, that come in and these testimonials that are unsolicited that come in and especially when we onboard a community or a hospital the first couple of weeks, people are just like overwhelmed and
wow.
I could go on for hours on all the stories, but I'm
sure those are really rewarding.
They are. And that's what keeps us going every day and keeps us driving. And we're very passionate about what we do. You have to be.
Sure. Well, there will be links in the show notes for sure to your website, which has some great resources on there. I'll just point out you have a FAQ section that has lots of great info on using your products on various devices, including voice assistants like
Mm-hmm.
Alexa.
Yep.
Your clinical trial results and other relevant research is on your website. You have a newsletter. Are there any other resources that you want listeners to be aware of?
No, I mean, follow us on social media. We're really strong there. We do a lot on Instagram. We do a lot on LinkedIn and Facebook and Twitter, but Instagram's kind of the biggest one biggest platform. So following us on Instagram at Coro Health, it would be great. Yeah. I mean, we post research and stories and testimonials and stuff there all the time. So
great. Well, this has been fascinating, David. I'm sure we could keep talking, but I'm going to have you close us out here. As you know, I have my guests close our conversation with a musical ending, a coda, by sharing a song or story about a moment that music enhanced your life. Do you have a song or story you can close us out with today?
Yeah, I think, one of the tipping points for me when we were first getting started, and I told you all the technology or lack of, was we were installing a hardware system in a memory care community. And there was this woman named Elizabeth that was just following me around everywhere I went. She was nonverbal, and she hadn't spoken in like a year and a half or 2 years. And she was just super curious about what I was doing, installing this box and speakers and all of this stuff. And it was actually at the nurse's station, and we hadn't even gotten into the rooms yet. And so, as I told you, we're running Cat 5 back to the nurse station and we were doing testing. And so I, radioed up to the folks in the control room, and I said, "Hey, just test a song here and make sure it's working." And so they piped in a Frank Sinatra song, and it started playing. And Elizabeth, who's like standing 6 inches behind me, she, like I said, she was following me around all day long, so curious. She just starts belting out singing. And
Wow.
I didn't know that she was nonverbal. I just kind of turned around and was smiling at her and enjoying. And the staff came over, and everyone was just like frozen. And so I pulled out my flip phone, again dating myself, and got a really grainy video of her just belting and singing. And there's a video of this on our YouTube channel of her, and she was in a choir. And it's incredible voice. I mean, she's in perfect key and singing and gets to the crescendo, and it gives me goosebumps just telling the story. It was so emotional for everybody, and her family couldn't believe it. And as soon as the song was off, the lights just went out.
Wow.
And it was over. And she was gone, and she was back to, this half catatonic state that she lives in. Anyway, over the course of, I think it was only about 90 more days that she lived, she would sit there, and then and just certain songs that would come on that would have an autobiographical response, and she would belt out. And so we've got an interview with her family members, also on the YouTube channel, talking about those last 3 months. And just like you were talking about earlier on, when you would visit nursing homes and see your grandparents and all this stuff, they have these incredible memories now of Elizabeth singing, not all the time. They didn't know what songs would trigger what songs. And that same Sinatra song, by the way, the next time they were like, "Oh, we'll turn it on." It didn't work. And so, they just would find certain songs that would trigger at certain moments in time.
Wow.
And, that's the power that music has on the brain. I mean, it's incredible.
Yeah.
We're starting to understand. We're learning more. You mentioned the fMRI analysis. The stuff that Dr. Sachs did is incredible. Seeing Beethoven versus Bach, that's one of the most amazing videos. If you've never seen it, it's incredible to be able to see how his brain reacted. And that's exactly what was happening with Elizabeth. I mean, it's pretty powerful stuff.
Thank you so much to David for sharing that touching story. There's a link in the show notes to a YouTube video clip of Elizabeth. If you or a loved one could benefit from these applications of music, be sure to check with the facility you're involved with to see if they offer music first and Coro Health's other offerings. If they do, take advantage of these evidence-based, non-pharmacological, and life-enhancing tools. If they are not offered by your facility, Request them. Be part of the change you want to see by helping to spread the word of this research and music tech products and communicating to facilities your interest and desire for these tools. As we mentioned, Coro Health's research and study results are available on their website, and you can also easily share this podcast episode with administrators. You'll find all links from today's conversation in the show notes, as well as a transcript of this episode and links to related episodes you may enjoy. There's also a link to Rob Marshall's Sounds Good Substack, which is how I heard about Coro Health. If you're at all interested in this intersection of music, neuroscience, and healthcare, follow Rob's Substack. I get it delivered to my email inbox every month. It's fascinating, and it only comes out once a month, so you will not be inundated with email clutter by signing up. You can always connect with me on email, mindy@mpetersonmusic.com, Facebook, Instagram, Twitter, or LinkedIn. Thank you so much for joining me today and for sharing the show with those in your network. Until next time, may your life be enhanced with music.